Our nation has achieved a medical miracle. We have delivered a safe and effective vaccine in just 9 months. This is one of the greatest scientific accomplishments in history. It will save millions of lives and soon end the pandemic once and for all.
That is the buzz phrase, medical miracle. That's what President Trump is calling the FDA's authorization of Pfizer and BioNTech's coronavirus vaccine for emergency use. The move putting us one step closer to people getting vaccinated. The next step is a vote, which is scheduled for a little bit later on this morning from a CDC Vaccine Advisory Committee known as the ACIP. Mara Siriani joining us live now from the CDC. Mara, this vote is the final hurdle scheduled for today?
It is, Joe. So many people waiting on this. So that panel is expected to meet at 11 o'clock this morning, and they actually bumped things up because initially that meeting was scheduled for tomorrow. However, it is now taking place today following the FDA's emergency authorization, which happened last night. So I want to walk you through how exactly things will work today and what will happen, because this panel will be meeting virtually. Now, it must vote to recommend a vaccine. The CDC must then accept that recommendation for vaccinations to actually begin. The last step in the approval process would be the green light today from the CDC. From here, of course, injections could be administered within days. In yesterday's ACIP meeting, known side effects were detailed, things like pain at the injection site, headache, and fatigue. But as we know, those are pretty common side effects with other vaccines as well. Nothing out of the ordinary. Also discussed 4 cases in Pfizer's trials of Bell's palsy or partial facial paralysis, but as of now, the CDC is not calling it a vaccine side effect. Of course, that is something they say they will monitor. So we mentioned that vote after the 11 o'clock meeting. That vote is set to take place at 2:30 this afternoon. Of course, we'll update you on air and online as soon as that happens.
All right, Mara, thank you for that live report. Within 24 hours of final approval, a massive undertaking is expected to begin. Pfizer says most of the vaccines will ship from Kalamazoo, Michigan. Doses will be loaded onto trucks, moved to airports, and shipped by planes to places around the country. Then they'll be delivered by ground with the help of FedEx and UPS. During the whole process, the vaccines will have to be kept cold. Pfizer says it uses GPS-enabled thermal sensors to track the location and the temperature of each shipment. So in Georgia, who will get the vaccines first? Residents of our state's long-term care facilities will be high on that list. According to 11 Alive investigator Andy Parati, the state will use a web application called Tiberius to help determine who gets the vaccine using data points like demographics and public health information. State officials also plan to develop a multimedia campaign to get the word out that this vaccine is safe and about 95% effective.